So the first thing that is now different than before is that now it is very clear first that we need to do an early treatment. So we need to treat the patients from the beginning in the moment that we have the diagnosis of a multiple sclerosis. And the second important thing that now is very clear, we need to treat most of the patients with a highly active treatment. So at the beginning we thought we start all the patients with a first line and we wait and later the second line, so that we have lost time. And like in the stroke, time is brain is time, so that we need to treat the patients. We don't want to have a brain damage, so that it's very important that many of our patients that we know that we have a bad prognosis. These patients with a bad prognosis, we need to treat these patients from the beginning with a more aggressive treatments, with highly active treatments, and for these patients they will be better because we can stop better the disease and later they will have a better evolution. So that I think this change, this paradigm change, that we treat the patients before with highly treatments, I think is very, very important, and that is a big change. Because before we were doing always sequencing, and we were doing always waiting, and perhaps we have 10 years before that we have given a second line, and now it's very important to treat some of the patients with highly active treatments. Multiple sclerosis now is very complex. We have now a lot of treatments, so that I think it's important to know all the treatments, yeah. And before it was very easy. We say first line, second line, third line, and it was very easy. But now we are changing the mind, and we think we can give some of these powerful treatments in the first line, so that now is very complex. We have more than 16 treatments, and we need to look how to do. So that now we have new biomarkers. We try, for example, to use the neurofilaments. We try to use more the MRI, the OCT, and we try now on the prognostic factors, so that all together, prognostic factors, neurofilaments, OCT, MRI, that we can have a better profile of the patients, and for different profiles we can use different treatments. Otherwise it's very difficult to use the treatments because we have a lot, so that it's better now to have different profiles, and for the different profiles we can have different treatments.